So I wanted to say a very, very warm welcome to all of you that have joined us today for today's webinar for creating and applying tolerances for pipette performance. My name is Candy Gilman. I'm the Education and Training Manager for the Artel product portfolio for advanced instruments. And we are very excited to have you here. As we progress through this webinar, we would love to hear your questions. And so if you have any questions, please post them in the chat box for us. I'll be monitoring the chat throughout the webinar today, and I'm more than happy to answer any questions that you might have. And it's a pretty critical topic. This topic of pipette tolerances is definitely something that we are intimately associated with, because sometimes we have customers that will transition from utilizing external pipette calibration services to bringing pipette calibrations or verifications in-house. And one of those first questions that we receive is, what type of tolerance should I be assigning to these devices? And so we're very pleased to bring this valuable information to you. And so with that, I'm going to go ahead and turn it over to my colleague, Nick Anea, who is the product manager for the clinical side of our Artel products. So Nick, take it away.
Thank you, Candy. What a great intro. And thank you all for being here. I know everyone's schedule is really busy, so taking a few minutes out of your day, and hopefully this is relatively educational to you, and hopefully we make it fun. Like Candy said, if you have any questions at all, please throw them in the chat. I have some colleagues like Candy who are going to be monitoring it the whole time, and we'll answer them. So without further ado, let's get this thing rolling. All right, so before we start, I always like to give you all an intro to who I am so that you know it's coming from someone that's kind of been there and done that. So I've kind of spanned the industry all the way from protein work and IVD work at Siemens and ET Healthcare to genomics. And I've been at Artel for almost the last 7 years now, which is kind of scary to me at this point. But I've been in the field, I've been a scientist, I've been on the product side of it for almost a year now. So I kind of understand a little bit of everything and a lot of applicational work. So hopefully you can trust that it's a reliable source coming to you with this information. And hopefully you get a lot out of what I'm saying to you, because when I was in the lab, I didn't really understand a lot of this. And now going over to the Artel and the liquid handling side of things, whether that be pipette or liquid handlers, I really started to kind of understand this and preach it over the last few years as well. So, agenda. So I'm going to throw this GIF here. You guys, I'm not going to give any context, and hopefully you'll stay to the end and you'll see why I put this GIF in here to begin with, and it'll all make sense. But that's your motivation to kind of stay till the end, so I could kind of walk through why this little giraffe-looking product manager put this in there here. But for the agenda today, we're going to go really over why pipette tolerances matter, key terms. We're going to look at common sources of variability. Kind of the meat and potatoes of this all is a standards overview, how to really establish tolerances. Then we're going to go into practical examples. And then from that, we're going to move into data points for your tolerances and the frequency of these, how we think Artel can help you, and then just really open it up to a nice Q&A, and hopefully we get some good questions that we can answer then. So we'll try to move methodically through this. My goal is to get you all out before the hour, but if not, we have an hour to get kind of through this agenda in general. So the Artel product portfolio, I introduced myself. I just really quickly, without kind of as a shameless plug, and when kind of why you could trust us as a source is Artel's been around since 1982. If you want to feel old or young here, that was 10 years before I was born. I'll let you do the math to see how old I am at this point. But we've really been a global leader when it comes to liquid handling and quality assurance. Liquid handling, we're going to go over in a little bit what we mean by that, but we provide products and a method for really understanding your liquid handling within your laboratories, and really being in charge of the data that comes from your liquid handling tools as well. So we've been around for a very long time. I like to call us the gold standard when it comes to volumetric verification. And honestly, if you probably throw a rock, you'd hit an Artel customer in any of the geographies that we're located in currently. So just a little bit of a background on kind of why you could trust me and why you could trust us as a business. We've been doing this for quite a long time. So before we start on this, let's talk a little bit about liquid handling, right? I think liquid handling, we think of these big liquid handlers, right? But when I refer to liquid handling, I really refer to anything in a laboratory that involves liquid handling transfer, right? So I don't know if you could all see my mouse here, but essentially this thing that this little animated hand is holding is a pipette. I think all of us have seen pipettes. They have different sizes and flavors here, but everything that we do in a laboratory starts at the benchtop, right? Whether you're, whatever assay you're working on starts at the benchtop with these manual pipetting techniques. As we scale, we move more towards automation, where we're pipetting a lot, and these call our liquid handlers. As we scale even higher, we move into more liquid handling, right, and higher throughputs. But ultimately, everything that we do with liquid handling has some type of result and some type of impact, whether that be clinical, whether that be biopharma. So really, to level set everyone here and establish a nice base, when I refer to liquid handling, I mean everything, right? From pipettes all the way to liquid handlers. At times you'll hear me say pipettes, sometimes you'll hear me say liquid handlers in this, but in general, everything that I talk about today is going to apply really to both realms of the liquid handling world. So just want to establish that as a base for everyone here. Okay, so once again, to level set everything, when we're here today, why does pipetting tolerance matter, right? Whether that's pipetting with a liquid handler or pipetting with a manual pipette. And I really look at it in four main ways, right? One, to ensure reliable and reproducible results. Volume transfer is the base of everything we do, right? I think it's often overlooked, but if you're off with your volume transfer, all of your chemistry, all of your assay data is ultimately going to be thrown off, right? The next thing is we want to really minimize risk of assay variability or experimental failures. Those of you that worked in either biopharma or clinical lab, invariably, you've probably noticed failure in your life and you've probably troubleshooted. And a key that I think people forget when it comes to actual troubleshooting is the liquid handling portion of it, whether that be the pipette or the liquid handler. Another thing that we really aim to and strive to do is support compliance with lab accreditation. Those of you that are on this call probably work in different parts of the lab, whether it be clinical or in biopharma, and are probably under different accreditation bodies or under different regulatory standards. Ultimately, we want to be able to support whatever accreditation or standard that we're under. But lastly, we also want to maintain confidence in workflow efficiency, right? We want to make sure that all of our liquid handlers are performing all the same. All of our operators that are pipetting are really performing to the standard that we need for our general practice and for our lab. So this is why pipetting tolerance matters. Now let's talk about tolerances, really level set again on defining what these are, how we measure them, and how we kind of work through these processes. Now, these next three slides, I'm going to try to go really slow through. I always get lost myself, especially when I first started at Artel, because these terms continually change all the time. So we have great references that I'll mention throughout this presentation where you can really go back. But if there's any questions as I'm going through these next three slides, now would be the time to ask them in the chat. So key definitions, tolerances, right? What is a tolerance? It's an acceptable range of error for a specific liquid handling volume, right? So whether that be a pipette or a liquid handler, we want to be able to pipette within a range that we deem is acceptable for our assay or acceptable for our regulatory body at that point as well. And we define tolerance in two specific ways. One is we refer to as systemic error, right? That also used to be referred to as accuracy or relative inaccuracy as well. But essentially, this is, if we're looking at a dartboard, right, and this is how I always like to measure this, is really how close we are to the value that we actually intend to do. So in the case of the dartboard example, the goal of everyone who's ever went to a bar is to try to throw the dart right into the center of the bullseye, right? If I hit the center of the bullseye and I hit it, continually hit it, or got close to it, I'd be relatively accurate, right? So that's systemic error. Random error, right, is the ability to be reproducible. Some of you may refer to that as imprecision or precision, but is really how reproducible are you? Other things that people use is coefficient of variation as well, or CV for short at the same time, where standard deviation relates directly to CV as well. Those are all a measure of random error or precision in this case. But if we go back to the dartboard example, is how reproducible I am. So I may not be hitting the bullseye, but in this case, I'm really, really good at hitting this third ring on the exterior, and I'm really reproducible. So once again, to really go back to this systematic error is how close I am ultimately to the target. Random error is how reproducible I am, how I consistently can get back to that as well. Both of these are normally the measure of tolerance when we're looking at liquid handling. Now, to reinforce this a little bit more, I want to take the example of utilizing a pipette that was dialed into 100 microliter, right? So in this case, if I'm looking at a pipette that is, we did 10 data points with this specific pipette as well, this pipette would be both true or accurate and very precise as well, right? We're right around 100 microliters and we're pipetting it reproducibly every specific single time. In our second example, right, we are relatively accurate / true, but not very precise, right? We have some that are around 97. We have some that jump up to around 102. But when you average them out, we're right at that 100 microliter target in general. Then we also have things that are like this, our third example, which are untrue and precise. So in this specific case, we're not really close to 100 microliters, but we're consistently around 105 microliters each time. And lastly, and prior to me coming to Artel, we have people that are untrue and imprecise, right? Where we're not close to our target and we're not really reproducible, so we're all over the place. Now, I want to open it up to the group here. When you're for your assays in your general laboratories or your clinical setting, what's important to you? Accuracy, precision? What kind of is important to you? I'm going to be monitoring the chat too. I'm going to throw people on the spot here. Any ideas? True and precise. Great. Both. Wonderful. Both. We have a lot of people that say both. Great. Cool. And we'll talk about this a little bit more as we go. But in general, for a lot of laboratories, both, right? But these are two independent things as well. So we're going to discuss a little bit more about it applicationally as we continue on in the presentation, but it's just important to think about what is really important when we look at the assays and the workflows that we're ultimately doing. Great. So now to even confuse you more, and hopefully I'm not confusing anyone here, but I'm going to talk a little bit more about how, once again, they're measured. I already kind of introduced these to begin with, but the concept of precision is measured as random error, right? The concept of trueness is measured as systematic error. When you combine both precision and trueness, that equals accuracy, and the measure of accuracy is uncertainty. Now, if I just lost you and you're like, what did this guy just tell me? We have this beautiful shiny lab report 4 that you can have access to on our website. If you even reach out to us after this webinar, we'll give you access to this as well, which will go line by line through what these are, how they're measured, and how it works within your laboratories as well. But the key message here from this specific slide, right, is we want to have the lowest amount of systematic error and the lowest amount of random error when it comes to pipetting and any liquid handling that we're ultimately doing. Now, these two measurements are independent of one another, and we just saw that in our last slide. You could be very precise, but very untrue. You could be very true and very imprecise. So when we're looking at the ways of adjusting pipettes or adjusting liquid handlings, and we're looking at workflow efficiency specifically, just know that these things are treated separately from one another. They have a role in every assay, but really, it's dependent on your workflow and application when you're judging whether you need to be true or precise, or both, as some of you said in the chat as well. So hopefully I didn't lose anyone by going through these 3 slides. And these things, unfortunately, always change. There's some people in Europe that like to change these standards every couple of years and change the syntax and the wording of some of these things. So we try to this is the most accurate and the most recent version of these terms. So they'll continue to change. But if you get back down to accuracy and precision, or inaccuracy and imprecision, that's normally the root of these concepts in general. So I'm going to stop there real quick. Any questions on those 3 slides? Because that was the important part, and I just want to make sure everyone has that level of understanding before we keep progressing in this presentation. Questions, concerns? Kiran, will you please be able to share the link in this chat? Sure, no problem. Well, and Candy is just like the best Vanna White out there. Hopefully people know who Vanna White is. If not, then Google it, please. Don't date me here, but Candy just threw the link in the chat to Lab Report 4. Right. Any other questions before I progress? All right. And if you do have any questions, you could save it till the end as well, and we could go over this again at that point. All right. So now that we level set on what tolerances are, how we measure the tolerances, let's continue, right? I think in order to understand tolerances, we also have to really understand where variability comes from within liquid handling. Now, in this specific example, this is based around pipetting. This pie chart will change for liquid handling, but the concepts are the same in general, right? So when it comes to sources of variability, especially in the pipetting world, there's a few variables that we have to weigh, right? One is predictable failure, right? So, think about your car here, right? Or think about any product that you own. Over time, there's wear and tear. That's kind of predictable, right? Those are things, you have to change your brakes every so often, or you have to change your oil every, depending on your car, 5,000 to 10,000 miles. Those are predictable failure points that we can see. When it comes to other things as well, a lot of pipetting is air displacement pipette. There's positive displacement as well. There's environmental factors, right? So if we're using air coupled with a piston, if there's environmental conditions that change, whether it's hot, cold, humid, non-humid, those things ultimately will affect the delivery of the actual volume, right? There's also inherent variability, which, is just variability that inherently is within the system. There's accidental failures as well. I'm a klutz. My wife will attest to that. I drop things all the time. When I was in the lab, I dropped pipettes a lot of the time. We're the liquid handler. Sometimes you don't put the coordinates correctly and the head will slam into the plate, or the tips will slam into the plate. Those are accidental failure. But also, when it comes to pipetting, a big one that we see often and is the big skew of this variability pie is operator technique. When it comes to sources of variability, operator technique is the biggest source of variability in the pipetting / liquid handling world in general. So it really points to needing to be trained and also needing to have tolerances that can fit the operator's point of training as well at the same point. So now that we, again, level set it on sources of variability, let's talk a little bit more about the standards that are involved with tolerances. So I have a lot listed here. There's plenty more standards. I think these are the ones that we often see. So I really want to go through each standard and what they're kind of about and how they relate to tolerances, right? So once again, if any point you get lost in this or you have questions, please let me know. But first, we're going to start with ISO 8655. There's many parts to this specific standard, but basically ISO 655 defines the max permissible amount of error by volume class and is internationally recognized as well. We next have the CLSI guidelines, which is more in the clinical realm, but it's the recommended clinical lab calibration and verification for equipment within the clinical realm as well. We have manufacturer specifications. These are often what the manufacturer recommends for their pipettes or the liquid handlers. These often meet or exceed some of the ISO that are international standard requirements and are essential for some warranty compliance as well. We have ASTM standards, which are it's a standardized method for calibration and testing. There's NIST, which provides traceable volumetric standards and calibration service. There's USP, which are standards for pharmaceutical and volumetric equipment. And then there's EN standards, right, which are harmonized with ISO, and they're widely used in Europe as well. Now, additional considerations, and for those of us in the US, we know this. For those of us globally, we know this as well. There's national / regional metrology institutes that provide traceability and calibration services as well. I listed a couple here too, but more of the regional ones, especially like Europe, there's COFRAC, there's DAX, there's these different regulatory bodies that govern specific countries as well. There's internal laboratory SOPs, right, which are normally your QC or QA folks that often consider these standards and make a standard operating practice for you to hit these standards. And lastly, and the one that we hear a lot is ISO 17025, which is accreditation standards for competent calibration labs. So without boring everyone here, these are a list of the majority of the standards that we see in the liquid handling world, and often what we need to comply with when it comes to tolerances and limits and things that we're setting for our liquid handling. Questions on any of the standards? Any color that we could provide? This was, once again, Each standard here, we could probably take an hour to 2 hours on. So I just want to give you a big overview of them, just so you're aware of them. And then if you have questions on the specific standards, Artel, our support team, would be more than happy to walk you and help you through with the individualized standards as well. Just going to take a second and check the chat. Great. Cool. All right. So, okay. Let's get back to what we were talking about. So we've established tolerances. We established why we do it, why they're important. Now let's talk about really applicationally why they're super important as well, right? So we start with the tolerance formula, right? We have to understand the tolerances in general, right? For a specific assay or specific workflow I'm working in, whether I'm adhering to what regulatory body, what manufacturer setting, Artel specific standards as well. Tolerance isn't really defined in a vacuum though, right? And this is really the point of this slide is we don't want to set an arbitrary tolerance for a multitude of volumes. And what do I mean by that specifically, right? So, and I'll walk in the labs a lot of times and their 100 microliter tolerance will be the same as their 1 microliter tolerance. An example that I want to give you, let's say we have 100 microliter and 1 microliter, and we're testing both of these volumes. And I have a 5% inaccuracy and a 5% precision tolerance, right? I have a lot more room at the very top of my volume range at 100 microliters, 5 microliters give or take, to hit that tolerance. But as I go down in volume to 1 microliter, 5% of 1 is, we're really talking about 0.05 microliters then at that point of tolerance. So really understanding the volumes that you're working with is very important in setting the tolerance appropriately with those with those specific volumes. The higher the volume, the more wiggle room you have when it comes to accuracy and precision or systematic error and random error. The lower volume you have, oftentimes you need to widen the scope of these because you don't have a lot of volume to give either way. And then also it relates back to application too, right? Clinical versus research versus biopharma. I want to have tolerances that work within the assay type that I'm working with, right? I don't want to have tolerances that are super narrow when my applicational tolerance is a little wider or vice versa, right? I don't want to have a tolerance that is, super wide when my applicational tolerance is much smaller than that in general. All right. And I think this is the biggest part of this as well, and kind of why we're here today. How do we define these tolerances, right? So I think first we need to really define the volume ranges that we're using, right? So let's take, for example, if we're working with a liquid handler and we're using a 1,000 microliter head, or we're working with a pipette, a P1000 pipette, are we using the full range of that pipette? Right? Are we using down to 100 microliters? Are we using up to 1,000 microliters? And even if we're not using it, do we still need to calibrate this pipette and verify along the full volume range? That really is up to you, right? What volumes are critical? How should I check those volumes within those specific ranges? The biggest thing as well is determining the accuracy and precision based on your assay needs. Now, oftentimes, and I'll hear people do this, I've been doing this long enough to know that people will get a pipette or they'll get a liquid handler and they'll automatically use the ISO specifications or they'll automatically use the manufacturer limits as a baseline, right? That can be good, but those recommendations are very stringent, right? So you want to make sure that your limits are in accordance to what your operators can hit, what your assays work with. You don't want to have too tight of tolerances if your assay requirements are a lot larger than that as well. And we're going to talk about that. I'm going to use a specific example in the next slide. And once again, you want to adjust your tolerance based on your lab specific risks and critically, right? You don't want to just set arbitrary tolerances or use the manufacturer tolerances or ISO tolerances when your assay specifications are a lot wider or a lot more tight. You want to really understand those. And lastly, you really want to document these and review them. I know this is commonplace for most laboratories, but on an annual basis, if your pipettes continue to fail or your liquid handlers continue to fail, you want to understand the root cause of these failures. Is it the tolerance? Is it the operator? Is it the inherent variability of the system? You really want it. This is a thing that is always moving all the time that you want to be able to adjust with at that point as well. Great. So this is why I want to harp on this as well and talking a little bit more about manufacturer tolerances. I think a lot of people in the liquid handling world, once again, whether that be pipettes or liquid handlers, rely on manufacturer tolerances. We don't understand tolerances well enough. We think that the manufacturer has vetted these things really, really well, and that's why they make those specific claims. But the way I like to refer to manufacturer tolerances for those of us who have a car is like MPG, miles per gallon, right? When you ever go to a car dealership, you're going to look at that sticker. I have a hybrid, and I say, wow, I could get 40 on the freeway and 30 in the city. And then I look at my gauge after I buy that car, and on the freeway, I'm averaging actually 30 miles an hour. And in the city, I'm actually averaging 25 miles an hour, right? Because when the manufacturer did that, whatever car manufacturer, pipette manufacturer, liquid handler manufacturer in this case, they're testing these in the most controlled environment, right? They have operators that have been doing this for a very long time that are very skilled, right? They're using the same type of tips that are controlled every time, and they have a lot of data points that they take to establish these standards. Optically, it's always like spec wars for manufacturers. They want to report their pipettes to have the best tolerances at different levels. But that also makes it hard for an operator like me or you to hit these specific specifications, just like your car, right? We're not all experts in pipetting. We all don't work in temperature controlled environments. We all don't have the same types of tips that we're using, right? These are things that are really out of our control that the manufacturer ultimately can control. So it gets back down to what I was saying before is you have to understand your assay. You have to understand the workflows that you're working with to really set your tolerances, right? So this is a classic example, right? If a manufacturer tolerance is 0.3 for imprecision and inaccuracy, right? But your tolerance is plus or minus 5% in your assay, why meet the manufacturer spec, right? Why their scope is very, very small, but your scope is very, very wide for your assay. Why narrow the scope and make some of your pipettes fail, or some of your liquid handlers fail that may not fail here? And it's counterintuitive as well, right? So it could be the vice versa too, where the manufacturer tolerance or your tolerance may be a lot wider than your actual assay specification. So you really want to be cognizant and mindful of your workflows and what you're working with. And not just rely on the manufacturer or the ISO spec. You really want to just understand the data and set these limits for yourself so that you're able to hit these consistently. And if it is falling out of tolerance, it's not something that is because of the mechanical nature of these systems or the inherent variability. It's actually because something is wrong with the liquid handler or something is wrong with the actual pipette. And this is where we come into play. I like to call, if you don't remember anything from this entire presentation, or I talked too quick for you, or you didn't like what I was saying, I want you to remember Lab Report 5. I think this is one of the best pieces of collateral that we have as a company. This actually, through a lot of trial and error, through a lot of understanding regulatory guidelines, through a lot of practice and understanding assay workflows, will give you a set of recommendations to start with that are not manufacturer, that are not ISO standards, that work within a range that is acceptable for your assays and acceptable for a lot of the workflows that you're doing. So what we like to do is we don't use a fixed percentage across a full scale. We adjust our percentage based on the volumes that we're working with, nominal. So like, for example, 100 microliter pipette, we have different tolerances than a 10 microliter pipette. And this approach really aligns with ISO 8655 as well. So if not, I'm going to just monitor the chat real quick. Candy, could you throw this one in the chat for the group here as well? And she already did. So this really is, I think, a really good way of starting with your tolerances that most lab operators could actually hit, and also are really informed that when it comes to actually setting standards in general. Questions on any of that? Just want to stop real quick, level set, give everyone a minute if there's any questions on Lab Report 5. Candy has that in there for you to download, but great area to start with. This is specifically for pipettes, but these same tolerances could be applied to your liquid handlers too. Okay, cool. Well, let's keep going on. So we talked about tolerances. We talked about Karen, we will send you this PowerPoint after as well. No problem. We'll make this available for everyone on the chat. In general, right? We kind of went over tolerances, how to set them, but really in what I've been stressing, but I really want to stress again is we have practical applications for these, right? So depending on what area of the lab that you're working in, what workflow you're ultimately working with, the tolerances are going to change, right? The tolerances for high-put screening are going to be different for clinical diagnostic, or are going to be different from QC validation and calibration checks for regulated labs. So really be mindful, right? As an old genomic scientist working on, next generation sequencing, doing library prep. And our assay tolerances for some of our additions were very, very tight. We're talking less than 1% that could throw off my whole assay data. But when I was working in the IVD world, it wouldn't matter if I was 5 to 10% off with my antibody concentration that I was working with. So be very mindful of the application that you're working in and setting the tolerance from a data-driven perspective, not just relying on external sources. And once again, to really break down the nuances of these things, this is why we do this as well. So in general, tolerances are a piece of the equation, but in order to define tolerances, there's a couple other things that we need to work with, right? Data points, how many replicates should I ultimately do? And how often should I do these things as well, right? So tighter tolerances require more data statistically, right? So in general, I like to use this table. This is my own internal guide, but normally when I have a little wide set of tolerances, more in R&D, 3 to 5 data points normally suffice for me, right? I could get a general consensus of what's happening in an assay or what's happening with a liquid handler within that. But for normal standards or QC process monitoring, I need more data points, right? 6 to 10 normally surprises with a plus or minus 5% variation. As I get into the regulated environments, normally we're talking about 15 to 20 replicates that have plus or minus 3% variation. And then when I get into the calibration processes or validation, oftentimes we're talking 30 to 30 plus replicates that really establishes that plus or minus 1% variance. Why this matters, right? And it goes right back down to tolerances. Too few data points can create false confidence. Too many data points, though, could also cause paralysis by analysis, where there's wasted resources as well. It's best to align the number of data points with your tolerance risk and the right number of replicates in general. So tolerances, once again, just to reiterate, that's part of it. But in order to get the tolerances, we also look at the frequency and the amount of replicates here as well. What leads me to my next thing for calibration, right? So I think we've already established the amount, the tolerances, why they're important. Now understanding how often should we check our things, right? And once again, we have another great lab report that Candy's probably going to throw in there in 2 seconds, lab report 6, that really tells you how often you should be checking your pipettes or liquid handling. Pipettes, when I say that, could also be applied to liquid handling. But in general, it really depends on your institution and your workflow, right? What laws, what accrediting bodies are you ultimately under, right? What are your own internal quality requirements, right? But that really is on you. How critical is your data? How important is it getting it right the first time? And I'll give you an example, and we see this all the time in our workflows, right? We'll have a customer that reaches out to us that was just under an audit, and the auditor found that some of their pipettes or some of the liquid handling was out of compliance. What happens to that customer? Now they have to figure out the root cause of when that liquid handler went wrong, right? Or when that pipette went wrong, and rework all that work. That takes a lot of time, a lot of energy. So it's about mitigating your own risk based on your own lab. And all of this goes back down to tolerances, the frequency of calibration. Those are all a part of the piece of the pie when it comes to this process in general. Now, there are certain guidelines, and this is what we like to use as well for calibration frequency. The ASTM standard ultimately recommends a control check at least every quarter, a quick check at least monthly, and then test your pipettes or your liquid handlers when you're changing a lot. Now, this is just, again, a starting guideline. You can adjust the frequency based on your level of risk. For those of you that are working in highly regulated environments or things that are involved, patient samples that, you can't have rework, or if there is an error, it's a compounding error, then the frequency may be a lot more. Or if you're working in an R&D laboratory, which I like to call the Wild Wild West, was where I came from, is like, it's maybe not as often when it comes to some of your applicational and frequency verification and calibration checks as well. It's really up to you. And then how many data points should be taken for these checks? For a control check, normally we say 10 data points. For a quick check, 4 data points. And then for those are for fixed volume tips. And then for variable volume pipettes, 10 to 4 data points at a high, mid, and low point. That really encompasses the full pipetting range at that point. That way you're able to see things that are dropping out relatively quick, whether it's at the high or the low end as well. Okay, that was a whole lot in a very little time. So what I want to now go over, and a shameless plug, is Artel is here to help you with all of these things. We just talked about a whole bunch of processes. We gave you a bunch of lab reports that you guys could study and go over, but we really can help you in with setting these tolerances, setting your calibration frequency, setting how many replicates you have. And we have a bunch of different technologies and a bunch of different of trainings that we can ultimately do. But what I want to kind of show you really quickly within the next 5 minutes is just where we could help you establishing these things. So we have a few different product lines. We have our PCS, which really is focused on pipette calibration and operator training. We have our MVS, which is really focused on multi-channel pipettes and liquid handling and operator training as well. Besides these 2 things, also we have an Artel certification course where Candy, I like to call her our czar of training. Her and her team come out and train people and literally walk over everything I'm walking over right now with a fine-tooth comb and a lot of detail and train you and get you all certified. And we also have a liquid handling service as well, which really focuses on the liquid handling aspect of liquid handlers, getting data, utilizing that data to make meaningful adjustments to those liquid handlers, and making sure that they work very, very well. So I'm not going to go through all of these, but we're compliant. I like to, and the whole goal of these next 2 slides is really show you I like to call Artel and our products and auditors kryptonite. When they see our products, they know that it adheres to most regulatory standards. And they normally don't ask a lot of questions because we have a lot of buttoned up things. And you can see all the standards that we adhere to, both on our MVS and our PCS side of things. The ISO standards, whether it's 8655 or 23783, these are a couple standards and where we kind of play a role in, but we have many other standards that we adhere to as well. But the biggest thing that I want to stress to you is where we can help you as well. We can help you with data-driven tolerances. So I just gave you a lot of information. I gave you a lot of places to start, but ultimately it comes back down to your actual lab and your application. The beauty of our systems and what they do is you're able to actually get meaningful data and create your own tolerances, right? You can create your own replicates based on the actual data that you're getting and the frequency, right? People will come to me all the time and ask me the same question. What should my tolerances be and how often should I test them? The beauty of having a technology like the PCS or MVS or Artel product line is you get to drive that. Early and often you can test them, see when you're starting to notice drift, see what tolerances your liquid handling can hit, and then actually set those. And that's meaningful data that you should be able to hit over and over again and easily be able to write SOPs with that apply to your quality standards and your SOP standards. So data-driven tolerances is one way we could help you. Alignment with industry standards. I just showed you all a bunch of separate ISO standards for 8655 and 17025. Our systems and our technology and our people could really help you understand these standards and be compliant with a bunch of them as well. Calibration and performance qualification support, right? So the beauty of Artel technology as well is you're able to actually calibrate and verify your liquid handling with our software. You don't need to go externally for that. And you can map that out over the year, over the quarter, over the month, and really have everything in real time as opposed to relying on an external vendor or an external manufacturing procedure. And lastly, training and method consulting. When you buy Artel, and why you're here today in general, is you get us. You're not buying the MBS, you're not buying the PCS, you're not buying our training, you're not buying our liquid handling service. You become a part of the Artel family. We're here to help you, right? We're here to train your people. We're here to help you, consult you on your tolerances, how many replicates you should be setting, what are things that you could ultimately be hitting, right? This is what we're about. We love these sessions because we get to see you, we get to help guide you, and we just give you visibility on what our knowledge base is as well. This, even if you're not an Artel customer, we love to be the leaders in this field and just really help you guys understand the standards and what you're looking at. All right, so I promised you that I put this little child in earlier, and I told you I'd talk a little bit about this at the end if you stayed through the whole presentation. So this is near and dear to me. I have a 5.5-month-old now, so just getting into numbers and shapes and things. But really, what I kind of want to illustrate this presentation is, you see this child. She has a square shape here, right? And she also has a nice little shape outlines. Tolerances are just that, right? We want to be able to adjust our tolerances and put them in the right bucket, in the right hole in this case as well. We don't want to set tolerances that are not in accordance with our regulatory standards or a specific applicational focus, because then we're just going to be hitting ourselves, our heads against the wall to understand why we're not hitting those tolerances, or failing products or failing liquid handlers, pipettes or liquid handlers that are actually passing. We just put too tight of tolerances. And we see this all the time in the field. People set tolerances, they don't understand why they set the tolerances, but they can't hit them. So they're taking their liquid handlers, they're taking their pipettes out of inventory until they can hit them, when really it wasn't the liquid handler, it wasn't the pipette, it actually was a tolerance that they ultimately hit. So I hope that gives you a little bit of an idea of, I always go back to this all the time, is setting the right tolerance really gets you a leg ahead. All right, now what I'm going to do is open it up to questions. So let's do it. All right, I already see someone has a question. Great question from Christopher. So can Artelware export pipette statistics during calibration/verification event? A week of testing, blah, blah, blah. Sure. So we didn't go through the Artelware software, but if you reach out to to us after the call, be happy to walk you through it. Definitely. When it comes to our Artelware software, it guides you A through Z through the exporting functionality. It really gives you all the data in an exportable way, and also it gives you the pass-fail tolerances that you want to set, whether it's the ISO standards, manufacturer, or your own internal standards as well. Hopefully it answered your question, Christopher, but more than happy to walk you through the software in more detail after the fact. Other questions? Are you tired of hearing me talk? Because I'm tired of my own voice. Sure.
Nick, I just wanted to add, if I may,
Sure,
because
please,
oftentimes I know from a support standpoint and from a training standpoint that customers are just looking for something prescriptive when it comes to pipette calibration. And there are very few standards and very few regulations who actually state, here's the tolerances, or here's some recommended tolerances. And ISO 8655, as you mentioned, they're one of those standards that has a table of permissible errors. But the other thing that they don't necessarily talk about is that the rest of, there are other environmental recommendations built within that standard that talk about having humidity at a constant 45 to 65 or 85%, and not having temperature deviate outside of 0.5 degrees Celsius either way. And that's strictly about the success of the pipette in the laboratory. And so I really just wanted to highlight the fact that standards like 8655 also talk about process tolerances, and that's why it's really, really important for folks not to just look for a roadmap to say this is what I should do, but really give some thought to how that pipette is used throughout the process and how it truly needs to perform, and not necessarily base it off of what a black and white piece of paper or electronic piece of paper or document might state, because I know that sometimes we get lots of folks that kind of fall into that trap, if you will, and we making an educated decision on what your tolerance should be when you're calibrating pipettes, super, super important.
Yeah, thank you. That's great color. As you can see, Candy's been doing this for a very long time, so she is the master of anything pipetting / liquid handling. A couple follow-ups, Jen. We could definitely give you some more information on our training. We'll reach out to you after this. And Tracy, we'd be more than happy to walk you through how to set up an annual schedule. We can either walk you through it, reach out to you, or if you reach out to our tech support team, they'd be more than happy to walk you through that as well. Other questions, concerns? Leo, no problem. We will reach out to you as well. Any other things, any questions or concerns? And we'll probably be reaching out to anyone who is on the chat anyways. Just, if you want our contact information, we normally like to follow up after it anyway. So you'll be hearing from us. We promise not to spam you unless you want to be spammed. Other questions, concerns? Just so maybe, Tracy, could you give it a little bit more color to that question? So Tracy asked, just after you decide that you can write it into your policies, maybe a little bit more context there.
I think what she's saying, Nick, is that whatever you decide for your tolerances, make sure that your SOPs and your policies reflect that. And certainly what I've seen is sometimes people get very, very optimistic and they set these really, really tight tolerances. And then they start getting real-time data on how pipettes perform within their laboratory environment. And then they have to broaden those tolerances. And sometimes that can be a little bit sticky when it comes to auditors and inspectors who then ask you for justification on why did you start with this type of tolerance and then have to broaden it out to another tolerance. So I suspect that might be what Tracy's referring to, is just make sure your SOPs reflect what you're actually following and how you're calibrating your pipettes.
Yeah, beautiful. And I even give you guys an example of that as well, not even in just the pipetting world. Is a couple years ago, I was at a customer site. They decided on tolerances before they actually checked them. They put it in their SOPs, and they put a very tight tolerances at 1 microliter. So at 1 microliter, they put a 5% inaccuracy and a 5% imprecision that they can never hit. But they just arbitrarily chose that tolerance based on the liquid handling manufacturer, right? So it's very important to really understand the data and make sure, and why I stress that, whether it be Artel or another product, hopefully it's Artel, to really have data-driven tolerances before you put it into your SOPs. Because as Candy mentioned, once it's in the SOP, it's almost like law, and trying to revert those SOPs takes a lot of revalidation and a lot of work, depending on the quality team and the organization as well. So to really be cognizant before you put it into your SOPs and really make sure it's data-driven. Because if that customer ultimately would have checked a liquid handler at 1 microliter and found out, hey, actually that 1 microliter is normally hitting around 10% every time, I'm going to set my tolerance around 12% because I know that's achievable. And also my assay results will be right in line as well. So that's very, very important. Great. Jose, if a pipette needs to be adjusted because the minimum value is out of tolerance, where is the recommended adjustment? To the nominal volume or the minimum value? Great question. Candy, I'll let you take this one.
So thank you, Jose, for that question. The answer is it depends, which is everyone's favorite answer, of course. So it depends on the pipette manufacturer and their micrometer adjustment tool. For example, I know with Gilson, with their adjustment tool, that they actually recommend that you make micrometer adjustments at the very lowest volume. But I know with the Rainin LTS tool, for example, for the LTS pipettes, they don't have a specific recommendation on what volume you make that adjustment. The one thing that I will say is that regardless of which volume you choose, you are still going to want to, of course, perform an as left calibration on the low, the mid, and the high volumes, regardless of whether or not you adjusted at a very specific volume.
And the micrometer, just to level set as well, the micrometer is the last step too, right? We don't want to make an adjustment before we actually change an O-ring, change a seal, because then you're chasing something that actually wasn't the issue, and you've adjusted it, and now you're going to be out of spec as well. So always make sure we're doing that first. Same thing for liquid handling, right? We don't want to make an adjustment before we actually check the O-ring or the seal and make sure we change those. Other questions? This is great. You guys keep us energized over here. Any questions on a dumb question here? So please ask away. If it's in your mind, we would love to hear it. Is there a recommendation of a manufacturer? Oh, good question. We are liquid handling and pipette agnostic here. I think any liquid handler or pipette is as good as you understanding how they work and you defining the tolerances. So we are Switzerland when it comes to telling you our favorite brands. If you pay Candy in dark chocolate or hard cash, he may tell you behind the closed doors. But I truly believe that most pipette manufacturers are relatively good. It's just how you understand the data that comes out of it and adjust that data based on that manufacturer of that pipette.
The other thing that I would add to that, Nick, is it also depends on which tips you are opting to use with that particular pipette. Because if you are choosing a maybe say a lower quality pipette and you're trying to use universal pipette tips that are one size fits all, you're really taking your margin of error and it's going to compound pretty quickly. And so when we think about how pipettes function, it's their tips and the pipette itself that makes your pipette system. So those two items together. And so making sure that you're performing feasibility studies and really understanding how those tips are working with that pipette, and then also calibrating those pipettes with the tips that are being used on those devices, all very, very important tasks to perform.
Great question though, Khalil. We hear that all the time. Is there a pipette brand that you recommend?
I do have a favorite, but I'm not going to say it out loud.
But also, same thing for liquid handling too. Once again, liquid handlers and pipettes, all the nuances that we've talked about hold true. Most of them are air aspiration devices, right? So what we're talking about when it comes to pipettes really apply to liquid handlers too. We'll love to talk after, Khalil. Once again, you can bribe Candy with dark chocolate. That I'm letting you guys in on a little secret here. Yep. Great. And a tip is important in environmental condition, 100%. Other questions or concerns? Great. All right. Without letting you guys off a little bit early, hopefully this was very educational to you guys. We will follow up. If you have any questions after this, we're here to support you. We're here to guide you. We'll hopefully be having more of these webinars for you to see where we'll pick another topic. So please let us know. And thank you for coming. I know your time is valuable, so hopefully you got something out of this as well. Thank you, everyone.